My name is Dr. Fliss Murtagh and I am the lead for a project funded by the National Institute for Health Research. Over this 5-year project called Sea Change, we are working with patient and public partners. We are open to ideas from them because it helps us deliver better evidence and give greater impact for those needing palliative care.
But there seemed to be an inability to actually record and measure the impact of the patient voice. And particularly in palliative care, that can be very challenging. So what we really wanted to happen over the next 5 years was to demonstrate that and ensure that 5 years out, we can actually point back to perhaps a series of videos or documents that say we really did ensure that the patient voice was listened to, heard and acted upon. Not just in terms of the process of involvement, but also in terms of the actual outcomes of that involvement. Sadly, about 4 months ago, my mother-in-law died. Now, she came from a large and devout Muslim family. And towards the end of her life, literally in the last hours of life while she was in hospital, she received outstanding spiritual care. The staff were in tune with her and her family's needs. They provided a room for her and her family to have time and privacy to be on their own. The result was that her daughters were able to read sections of the Quran to her in her dying hours. And I know that would have brought huge levels of reassurance and comfort to her, and a knowledge perhaps that what would come next after death was a lot more clearer to her.
We were sad to hear about this family death, but it does sound like the nursing team helped the family to create a very comfortable environment. This experience caused us to reflect more about the changing end-of-life care needs in our culturally diverse society. We discussed how extensively can we ensure that the different perspectives from diverse ethnic and cultural backgrounds are reflected in our work.
I think really the summary of that was that we need to work out a way that we're going to be able to involve and engage the huge diversity of people who have very diverse religious and other belief systems in this programme over the next 5 years, so that we can ensure that their needs are captured and that we don't just get a narrow remit.
In response to this, we decided that we will expand our patient and carer panel to include more people who are representing the interests of ethnic minorities. We hope this will help us achieve research outcomes that are more relevant to all different diverse groups.
The third issue we talked about yesterday was the issue of measures. Now, we recognised the importance of measures, but I think we questioned a bit whether we were jumping the gun on measures. We got some fantastic measures in there, like for example the POS measure, well validated. But our question was really, do we know with absolute certainty that we're capturing the entirety of complex and diverse needs that are represented in a population such as our own, and also a broader population across England? Are we absolutely confident that we have captured that?
As a research team, we have given some careful thought to this. First, it is important to understand that the patient voice has really informed the development of the measures we are going to use, especially the measure called 𝐼POS. The questions have come from detailed qualitative interviews with people, telling us what are the most important priorities for them. This was followed by careful testing of this measure across wider groups of patients and families to see if and how the questions worked. As a result of all this work, over maybe 10 or 15 years, the 𝐼POS measure has been developed, and it first asks people to list their own problems or concerns before any standard questions. It then goes on to ask about symptoms, about anxiety or family anxieties, feeling depressed, being at peace or not, and whether people are able to share feelings with the family as they want, and information and practical needs. It therefore covers a wide range of potential concerns. Secondly, as a team, we felt it was important to test again whether the whole group of measures proposed covers all of the important areas for patients. So we have taken 2 more steps. First, we have arranged to undertake secondary analysis of some of the interview data from our previous work to check again whether all the areas that matter to patients and families are being addressed. Furthermore, we have agreed to extend some of our stakeholder interviews to include patients and carers in this analysis. This will provide a more complete view of some of the issues.
Well, this has been the first video pod, as I said. I hope it's one of many. It's really just sharing the patient perspective from a meeting that we had yesterday. I understand that Fliss Murtagh will also do a parallel brief video recording that will demonstrate how she listened to some of these concerns and what her decisions were, and the senior management team's decisions were, reflecting on those concerns and whether there are any changes to the project moving forward as a result, or its design or its plans. Thank you very much indeed.
We have found this video log a very helpful way to capture some of the impact of our discussions. So a sincere thank you to Jonathon for the idea and for making it a reality.